So, Dr. Scholz, today we're talking about proton therapy. We get many questions regarding this type of radiation. There's a lot of marketing behind it. And so, what is proton therapy?
I think of proton therapy as a quality form of external beam radiation therapy. Radiation can be given through a powerful beam at a target, an invisible beam, and radiation can also be implanted. We call that brachytherapy. There are many types of beam radiation, proton therapy being one type. Basically two types, proton and photon therapy. All the other types of radiation that we generally hear about, stereotactic body radiation or SBRT, intensity modulated radiation or IMRT, these are photon beams that are given over a variable period of times. Proton beams is a different particle, a heavier particle, and it's touted as being less damaging because the radiation beam stops at the target instead of passing through the body and going out the other side. In my experience, I think that's a good advertising ploy, but I don't think that it truly translates into fewer side effects compared to photon therapy. I think it's equally effective. And modern therapy with either photon or proton treatment has become dramatically less toxic than when it was first introduced 20 years ago. So proton therapy is a type of beam radiation that is administered in specialized centers. It's an effective, attractive type of treatment, in my opinion, quite superior to surgery, available in multiple centers around the country.
You know, we mentioned other forms of radiation. What are the cure rates in comparison to SBRT or IMRT?
I think that's comparable. So cure rates are impacted much more by the type of cancer or the stage of the disease than it is by the type of radiation that you receive. There are pretty good studies showing that short and long-term photon therapy have the same cure rates. That would be SBRT compared to IMRT. There aren't any studies directly comparing in a randomized prospective fashion proton therapy with photon therapy. My strong belief, based on having proton therapy here in Southern California now for over 20 years, is that the cure rates are equivalent between photon treatment and proton therapy.
So we hear a lot of conversation around focal radiation. Can you do focal radiation with proton therapy?
In theory, you can. Focal treatments can be utilized with any form of therapy, radiation, high-intensity focused ultrasound, laser. I've never heard, of course, of focal surgery. But focal treatment is feasible, but really not being practiced much outside of clinical trials at this point.
So we hear a lot about different radiation side effects. What side effects can we expect when it comes to proton therapy?
The number one problem, now that the radiation doctors have figured out ways to avoid rectal burns with a implanted gel called SpaceOAR, and they've pretty much learned how to shoot around and control urethral toxicity, which is the urinary passage through the middle of the prostate. If that gets too much radiation, men can be left with interminable urinary symptoms and problems. Or if they over-radiate the base of the bladder, the same problem can happen. The unavoidable side effect that still presents a major issue with radiation treatment is erectile dysfunction. And depending on a man's age, the incidence of erectile dysfunction is quite significant. In a 70-year-old, you're looking about a 50-50 chance that ED that doesn't respond to Cialis or Viagra will ensue. In a 55-year-old man, maybe a 25% chance that serious erectile dysfunction that does not respond to Cialis or Viagra will ensue.
And when it comes to PSA decline, you know, a lot of times when we have surgery, people expect a rapid PSA decline, and different forms of radiation, it can be over a period of time. So what should the PSA look like directly after proton therapy and then 2 years out?
Right. People sort of assume that when you undergo any type of radiation, either proton or photon, that you're going to burn the prostate out and PSA levels will plummet down to zero rapidly. And that's just not the case. Men still have a prostate after radiation. The prostate doesn't disappear, and you're not burning out the cancer or the prostate. What you're doing is you're putting radiation into the tumor cells, which is poisoning them, poisoning the DNA. And when the day comes for those cancer cells to try and divide, they discover that they haven't got the adequate DNA to do so, and that's when they die. So if you look at PSA levels over an extended period of time in an effectively treated patient, PSAs will sort of float down over a period of 10 to 20 months. And as long as patients are in decline, we're very happy with that. And PSAs will eventually settle in at around 0.5 or something in that range. So immediate PSA declines are actually somewhat uncommon. They can happen.
When it comes to proton therapy, can you treat the seminal vesicles and lymph nodes as well, or is it just the gland?
You certainly can, and the decision to treat the seminal vesicles or the lymph nodes is based on the stage of the disease and what type of protocol people want to implement to optimize cure rates. Some men have such favorable types of prostate cancer that it would be overkill to treat the lymph nodes, but others are at significant risk, and such treatment to the lymph nodes can be given rather safely now. So it's certainly a consideration for some individuals.
And overall, I mean, we have multiple stages of prostate cancer. When people come into this realm, they're kind of learning what stage they are. So who is eligible for proton therapy?
Well, we think, of course, in terms of low, intermediate, and high-risk prostate cancer. At the PCRI, we call it sky, teal, and azure prostate cancer. And we don't recommend any type of treatment for men that are sky or low risk. They have a harmless variant that doesn't spread. But for the teal and the azure patients, or the intermediate and high-risk patients, proton therapy would be a very reasonable option.
Could proton therapy treat bone metastases?
Any form of beam radiation, including proton therapy, can be used to treat spots of cancer that have spread throughout the body. We call that oligometastatic cancer. There's also, thankfully, fairly rare situations in this modern era where people have a spot on their bones that is hurting, and proton therapy or regular radiation, photon therapy, could be used to eliminate that pain.
One of the questions we received in the comments section, I guess a patient was in a support group and they heard about a balloon when it comes to proton therapy. What is this balloon? I heard it was quite uncomfortable, and how does that work within the procedure?
Loma Linda here in Southern California was one of the earliest proton centers, and back then they didn't have conformal treatment. They didn't have spacer to protect the rectal wall. It was realized that if you could somehow push the posterior rectal wall far enough away from the prostate, that when you radiated the prostate, at least you'd only radiate the anterior wall, and thus reduce the chances of proctitis, radiation proctitis. Prior to each proton therapy treatment, they would put a inflatable balloon in the rectum. It would be blown up, and it would push the posterior wall away from the treatment field. And so this is, I believe, still being utilized at Loma Linda. I could be wrong. I know up till recently they've been doing that. Not really sure why they would, since I believe spacer is a better approach, because you can push both the anterior and the posterior wall out of the treatment field and eliminate the risk of proctitis. The idea of using the balloon is to cut down the chance of radiation proctitis.
So where can people get proton therapy? Are there centers around the country? Is it kind of a niche thing in certain pockets of the U.S.?
Well, here in California, I'm only aware of two centers, one down at Scripps in La Jolla, California, near San Diego, and the other at Loma Linda, which is in Southern California in the Inland Empire area. I'm not sure how many centers have started up. I think there was a government initiative to help fund these expensive centers, and I believe there are quite a few now available around the country, but I'm not specifically aware of where they're all located.
So besides looking online at reviews and also asking the center how many procedures they do a year, is there any other information that patients should look for in regards to searching out for a proton therapy center?
Once a center has initiated, built the infrastructure, has the equipment, then I think the popularity of it will give them a lot of experience quite rapidly. So probably most of the centers that exist now, which have been around for a little while, have more than enough experience. Be aware of the fact that not all of the proton centers are using intensity modulated computerized techniques. I believe that Loma Linda still is using the older conformal techniques, which in my opinion is less precise. So if someone wants to pursue proton therapy at some center of excellence, I would inquire, do they have intensity modulated modern computerized targeting, because I believe that would be superior.
Thanks so much for watching. If you would like more information about prostate cancer and all sorts of education, you can visit our website, PCRI.org, and subscribe to our YouTube channel. We come out with new prostate cancer education videos every week.